Hi, my name is Tracey Hotta, and I am aesthetic nurse injector. I have been in this specialty for almost 40 years, or been in nursing for 40 years. And I am honored to be presenting to you during the nursing week. Um, Being in the specialty for, in nursing for 40 years, in the specialty for 34 years, I have a wide range of experience that is in my background, which is what I'm going to do. I'm going to go through our outline, which is what is medical aesthetics. I'm just going to turn off my camera here. So, what is medical aesthetics? Talk about a little bit about my aesthetic journey. Clinical education, what you need to have, sort of the important clinical components to be in aesthetics, and then beyond needle to skin. So, as you know, ANBLPN just recently put out their new guidelines for aesthetic medicine, and it is, elective procedures. So these are not procedures that need to be therapeutically performed. So they're cosmetic procedures, and it can be related to laser treatments. So it could be IPL, the skin tightening procedures, soft tissue fillers, which is sort of the number one thing. So soft tissue fillers, volume enhancers, collagen stimulators, such as Sculptra or Radiesse, lipolysis, which would be your deoxycholic acids or your Balkyras, in order to break down the fat cells. Platelet-rich plasma therapy, very, very popular procedure. And your neuromodulators such as Botox, Dysport. There's 5 approved neuromodulators on the market. So to go through a little bit about my aesthetic journey, I wanted to be a nurse when I was 9 years old. So my dad is a physician. There was a physician in Moncton. I was born in Riverview, New Brunswick. He was a physician in Moncton, and I used to go over when I was 9 years old and go to his office on Saturdays. And that's where I met Alice, who was his nurse. And Alice really left a long-lasting impression on me, which is why I wanted to go into nursing. She was respected by the patient. She was respected by my father. She had complete control over the clinic, and she was very well organized. And I was just like, I want to be an Alice when I grow up. So I used to go there quite often. And with my education, I graduated from high school in 1980. I went to St. FX University, started out in my Bachelor of Science. My dad went on sabbatical for a year, so I went back home to Moncton to live with my sister. So I went to AJ McMaster School of Nursing at the Moncton City Hospital, so the 2-year diploma program. Worked in the ER and operating room, and then went back to school in 1996 when I moved to Toronto and got my BSCN from Ryerson University. So in that time, I think it's really important to gain a lot of clinical experience, even before going into aesthetics. Having that background knowledge, I feel, is really important. So in 1984 to 87, I worked at the Moncton City Hospital, loved working there, worked in the emergency room, and then got a full-time position in the operating room. Then moved to Ontario, worked in the operating room at Guelph General Hospital, then moved to Scarborough and worked in the operating room at Scarborough General Hospital, which is where I met a plastic surgeon. So the plastic surgeon was opening one of the first out-of-hospital premises private cosmetic surgery clinics in Canada. And this was back in 1990. So he hired me as a 28-year-old nurse with OR experience, no management experience. Saw something in me that I didn't see in myself, is that I'd be able to manage his new clinic. So it was really a challenge to be, looking at how to manage the staffing and develop a policy and procedure manual and how to do a proper accreditation, because you had to be CAASF accredited to have a out-of-hospital premises facility. During that time in 1992, a sales rep came over she's from Ontario, but she was over in Europe, and came back and said, all the nurses are injecting dermal fillers over in Europe, and we need to bring that program here. So I was one of the first nurse injectors in Ontario. It had already started out west with Dr. Carruthers, who is the grandfather of Botox. But there was 5 of us that were the first ones to bring it to Ontario. So that was a challenge. It's, authorized prescriber and, what does the word supervise mean? And having to have your policies and procedures to support your practice. So it was a starting right from the bottom. So I worked with him for 15 years. And then in 2005, I joined another plastic surgeon's office in downtown Toronto, established another medical aesthetic practice within his practice, and hired estheticians as well. And during this time, he was a very influential plastic surgeon who had some international speaking opportunities. So I became very involved with the surgery side as well, and became actively involved in nursing organizations, which I think is important as you're developing in aesthetics, is to become involved in any organizations of like-minded people. In 2014, I then decided to go into an independent practice in Thornhill that was just north of Toronto. So I had that practice for 8 years, and I had an on-site nurse practitioner and I had an off-site GP within my practice. And then I hung up my needle in 2023 and I moved to Halifax, and it was a great move. So during that time where, I think it's really important to get involved with associations of like-minded people. So I joined, it was ASPSN back then. Now it's the International Society of Plastic Aesthetic Nurses, based out of the US. Joined the membership in 1994, became the regional director for the Canadian region, was president, the first Canadian president in 2005. And the highlight of that is there was an FDA hearing for silicone breast implants, which I had to be the nursing voice at that hearing. Very scary. Also became the the editor of the journal, Plastic Surgery Nursing Journal, that's based in the US. So that was another learning experience. And I think anybody in medicine, that if you get offered a challenge, I think it's good to take it, because that's how you learn. I was the editor of the core curriculum, which is for the CANS exam. And then I continued to give back, without getting paid, just giving back, doing lectures and workshops, either in Canada or the US. The Canadian, we have an association in Canada. So I learned everything I could from the Americans. And then we established the CSASN in 2009. And it is the leading voice of nurses in Canada in aesthetic medicine. So if you're looking to go into this field, I would highly suggest to join this organization. Again, it's like-minded people. It's extremely professional. It's always talking about the, standards and guidelines and new trends and procedures and patient safety. So we had developed, we didn't have a president, we just have board of directors, because we want everybody to have an equal voice. We established our practice standards and guidelines in 2016, and it took about 2 years with a task force of nurses across Canada in order to develop this. And I'd say that this is one of my most honorable career things that I've done. They've been revised in 2020, and they've been since revised in 2024, because aesthetics is such a fluid field, and it's constantly changing. You really need to stay on top of it. Going into the clinical education. So there is a lot of different things that have to be, sort of in-depth knowledge that you need to have when you're going into aesthetics. It may not be as simple or as easy as it seems when you look at Instagram or any of the social media platforms. In-depth facial anatomy, assessment skills, pharmacology, adverse events, mentoring, and networking. So when you're looking at the facial anatomy, typically all we see is like needle to skin, here, this is your product and this is where you place it. But you really want to have that sort of that 3D visual image of where your needle is being placed, what it's close to, where it shouldn't be, where it should be, what level of injecting that you're in. So really need to have a really good handle or comprehension on the anatomy. Arteries is the main thing that we're always looking at for vascular occlusions. With our muscles, we need to know with neuromodulators, which muscle that you're treating and the opposing muscle that's actually going to be doing the work. And say in down here, you've got muscles on top of muscles. So you have to know whether you inject deeply or superficially. And you have to know, the nerves, whether it's the cranial nerve 5, 7, you have to know, and the ligaments as well. So a lot of background knowledge to make you a safer injector. And this is just an example of where we talk about with doing neuromodulators. So you have to know, is it superficial? Is it deep? Where is that muscle located? Is there is this mass around it? Do you have to inject below that mass? How many units do you use? So a lot of comprehension that you have to learn, and not just, how much to inject, but why you're injecting at that level, and why you're injecting, which product that you're injecting. Assessment skills is necessary, and aesthetics is a awesome field because it's combining art and science, and your assessment skills is bringing that art component into it. And I think, probably this is one of the most important aspects, is that you can really look at a patient and you can see how they're aging and things that you can do that you have in your portfolio of how you can help to address the aging issues. So, you're going to be learning about, the fat pads, is it loss of the fat pads? Is it bone loss? Is it the hydration of the skin? Do they need good skincare? And this is, you have a whole educational component where we would be talking about sunblock, and, you can, point out different health issues and things like that. So it's not just about the procedures that you're doing, it's sort of a global assessment. All kinds of facial assessment tools that you would learn as well. So you look at the photo damage scale, how deep are the wrinkles? Fitzpatrick scale is pigmentation, and whether heat applied to the skin is going to cause hyperpigmentation, which is what we don't want. So you really have to know the pigment levels of people's skin. Face shapes may determine how you're going to do a procedure. The beauty of phi, and that is the 1 to 1.618, which is the beauty ratio and facial proportions, and you can get really, into the science of everything and the of looking at all the different angles. But I think as a person goes on and learns more about aesthetics, you start to get a trained eye that you can just look at somebody in the grocery store and you go, oh, yep, that's off. But it does take time to develop that skill. Really understanding and looking at the different aspects of the treatment areas that you're treating, whether it's upper face, mid face, lower face, hands, neck, chest, any area like that. You really want to look at, what's causing the aging effect. Is it loss of fat? Is it the muscle activity? So in the lower part of the face, is it the contraction of the muscle that brings the mouth corners down? Because you could treat that with a neuromodulator. Looking at the shadows and the wrinkles and how they form their words. The distance, the ergotrade is the distance between the nose and the lip. So understanding that as you get older, that lengthens. And looking at, especially in this area, if you're doing, say, lip enhancements or anything, you gotta look at the dental health. So you don't want to be doing treatments on a patient if they have gingivitis, if they've got periodontal disease. So, and you would go through those with every area of the face that you're looking at treating. Relatively new. I think we weren't looking at this when I first started, 30 years ago. The gender differences, because now we have transgender patients coming in, and you have to know the difference between how you're going to make a male look female and a female look male. So understanding those gender differences and what you can do with what you have in your portfolio to enhance their natural facial features, because you wouldn't want to make someone look more masculine if they're wanting to look female. And there are a lot of difference between the two. Pharmacology. So any procedure that you'd be doing in aesthetics, so whether it's a neuromodulator, so botulinum toxin A, Botox, Dysport, Nuceiva, whether it's your soft tissue fillers, which would be Revanesse, Juvederm, Galderma, Teoxin products, anything like that, your platelet-rich plasmas, the Belkyra, deoxycholic acid. So you really have to know and understand what the mechanism of action is. So not just, the outcome, but why is it working that way? And then understanding how it works, and then looking at medical histories to make sure that there isn't anything in the medical history that may, they would be a high risk for that treatment with the fillers. So understanding the rheology. So understanding the lifting capacity, or how the product is made, and where that product would be placed in a different area with another product or rheology that is softer. So really understanding those. One of the most important parts is the identification, management, and prevention of potential adverse events. So extremely important that you would be able to recognize an adverse event. If you did have an adverse event, then you'd have to reach out to your authorized prescriber, because as nurses, and I'm a nurse, I can't diagnose an adverse event. So you always have to bring in your authorized prescriber. And when I first started, we weren't having a lot of adverse events because we weren't treating a lot of areas. And now you've got longer lasting products and you're treating more facial areas. So the risk of adverse events does increase. So these are all, the things that would be talked about, that you have to know what they are, how to prevent them. And you have to talk to your patients about them as well, because they're all pointed out in the literature. And you also have to know how to deal with any non-injection related adverse events. So if they have vasovagal, seizures, anaphylactic reactions, they can all happen in our chair. This is just a sort of a picture of a colleague of mine, and Julie has given me permission to use her picture. But if this did happen, would you know how to deal with this issue? And yes, you'd have to bring in your authorized prescriber. You may want to bring in a wound care nurse as well to help you with the process. Mentoring and networking is extremely important in this field, I find, because it's rapidly growing, and it's a skill set that we're not taught in nursing school. So this is completely different. You've got clinical skills that you learn in nursing, and then you have that in the hospital, but this is different, and it is self-pay. So, and you're working on people's faces. So the more mentoring that you have with experienced injector, and the networking that you have. So if you have an issue or problem, you've got people to reach out to, and there's great networks out there. So really get a good community together, that you have a lot of support. I can't stress enough of the mentoring and networking. So going beyond needle to skin, which is typically what we always see, that, this is the product, this is where it's placed, this is how much you put in, and then the end. But there is more to it than just that. There is looking at your scope of practice, which is the new ANB LPN guidelines, code of ethics, and just going to touch a little bit on documentation and consents. So as we all know, understanding your scope of practice, making sure that what you are doing is within your scope of practice, and that you are, reaching out to the nursing college if you have any questions or anything. That's what they're there for, to help you to understand if you have, if you've got a gray area or think you have a gray area with your scope of practice. I would reach out to them to make sure that you get the proper answer. We are a self-regulated profession, so which is amazing that we have that ability. But there is a code. There's our code of ethics that we need to follow. Nursing is the most honored profession, of course, according to the Harris Reid poll. We want to continue with that. So we want to make sure that our nursing values and our ethical responsibilities are following our code of ethics. And that's what they're there for, so that we are accountable for our profession. Just want to quickly go through, this is a discipline decision. So I do a lot of researching in all the different nursing colleges and just to see what's out there of disciplines or complaints or anything like that related to aesthetics. This one was the latest one that I found. So it was 2023. It's from the College of Nurses of Ontario. And I didn't find anything in New Brunswick. So yay, let's keep it that way. This was an RPN that obviously somebody complained to. So whether it was a public or a colleague, you don't know who actually performs that complaint. So what the college does is when they receive a complaint, they have to investigate. So they send an investigator out and they randomly take 16 patient records and they will do an audit of the records. So the result of the audit found that the member failed to provide appropriate cosmetic nursing care and had multiple infractions noted on the charts. So the background of this nurse, she was an RPN since 2005, self-employed, works out of a spa in her condo, and her authorized prescriber is a physician. It was noted in her complaint that she advertises her services across several social media platforms and offers a variety of nursing services. The allegations that came from her complaint and what the auditors found is that failed to obtain and conduct or document pre-treatment assessments. So, having to go through that assessment form, treatment planning, patient outcomes, and the authorization from the authorized prescriber that she is able to do that controlled act, made disparaging social media postings directed at a patient, failed to obtain consent from the patient prior to administering a controlled act. The way that they had the collaboration between the authorized prescriber, the physician, and the nurse was that there was a physician stamp that was supposed to be applied to the patient records for tracking and auditing purposes, and that wasn't done. And the member modified her records. So what they found was that there was a breach in the accountability standards. So performing a controlled act without receiving authorization from an authorized prescriber, which could technically mean that you're practicing medicine without a license, because we are not able to, as nurses, prescribe, diagnose or prescribe. There was a breach in documentation standards. So failed to document a complete record. So, looking at the assessment, planning, intervention, and evaluation, that all has to be documented. Didn't document that she didn't inform consent. It wasn't initialed, or she didn't sign it. Didn't document the consultations from the authorized prescriber. How was the consultation done? Was it, through, in person, through virtual consult, and again, modified the records. So this is what the college stated, is that the member's conduct was dishonorable. Demonstrated an element of moral failing through her repeated actions over a 2-year period, that she repeatedly failed to document, obtained informed consent, and did not have proper authority to perform a controlled act. In regards to her social media, They found that it was unprofessional and dishonorable. And they do have, and these are all public, like it's not like I'm revealing something. All these discipline decisions are made public. And they did have, what the council had is they took screenshots from Instagram. So, knowing that, if you've got something on an Instagram story and you go, oh, well, it's only on there for 24 hours, screenshots can be done. So those were submitted to the college. She responded to the patient outside of the workplace on Instagram and posted comments in a mocking nature. And the comments are posted in her discipline decision. So what the college said is that entertained and engaged in social media post that she knew or ought to have known was inappropriate, a nurse must act with decorum, which we know that. We have a professional obligation to our college to be uphold our profession. So her penalty had a 4-month suspension of her certificate of registration. Increased, it used to be 2 months, they've increased it to 4. Minimum of 2 meetings with the regulatory expert, and had to complete modules and questionnaires. When she returned after the 4 months to work, she had to let her authorized prescriber know of the discipline decision. And then the authorized prescriber had to perform 4 random audits during her 12-month period to make sure that she was documenting properly and providing the proper care. So they had to do that for 3, 6, and 9 months. What was new out of all the other ones that I had read, what was new is that they said that upon her return to self-employed or independent practice, she had to post entitled to practice with restrictions. So her name, RPN is permitted to practice nursing subject to terms, conditions, and limitations, and gave the public registry for people to go to. This is the first time that I've seen this. Had to be visible at all locations that she practices nursing, on all her websites, social media, or platforms where booking is done. And it was for a 12-month period. So that was, I hadn't seen that one before. So I think, as it says here, that the panel recognized that there is a rise in nurses practicing independently, and the type of misconduct demonstrated by the member is becoming more frequent. So we have to do better. We do. I mean, they're sending a strong message to the profession. So even though it's Ontario, a lot of people look to Ontario, and it's something that would be all across Canada. They also had this right in their discipline decision that the penalty sends a strong message to the member and the membership that engaging in control acts without proper authorization and failing to maintain the standards of practice for assessment and documentation will not be tolerated. So again, it has to do with patient safety. Documentation. So just a little bit on the documentation. Collaboration and consultation with other healthcare providers. You have to, so if it's an authorized prescriber, if it's an RPN that's collaborating with a nurse, you have to include who that care provider is, the date and the time that you shared information, the reason, the name and designation of who it was that you talked to. So if it's your authorized prescriber, you have to name them with their credentials every time on your documentation. Information provided, and the orders, intervention, and outcome of the consultation. There was a RPN in Ontario that lost his license for 4 months as well, strictly on documentation. The essentials of quality nursing documentation. So it must be timely. You can't go back or you can't, sort of pre-fill out your documentation before the patient comes in, even though it's a repeat patient that, maybe it's their 6th time that they've come in for a neuromodulator, but you can't pre-chart, but it has to be done in a timely manner. Documenting objective and both subjective data. So doing your medical history, and then, why they came in, their medical and psychological data is important as well, especially in aesthetics. There are some psychological red flags that can be sussed out with the medical history, previous treatments, reactions, name and credentials of the authorized prescriber, method of the consultation. Suggesting now that we do a baseline blood pressure, because if somebody goes vasovagal, then you have to find out what their baseline was to make sure that they are stable to be able to be discharged. Treating around the eyes, you're going to assess for the ocular movements just to make sure that there's no issue. If they come back in and they say that they have blurred vision, you want to know what the ocular movements were before. So really a lot of steps that make this more of a medical procedures, and they are medical procedures, not something to be taken lightly. Providing full signature or initials and professional designation on all documentation for the person that's providing the treatment and also the authorized prescriber. And then completing the documentation. So again, consultations, nursing active client responses. When you're looking, you're going to, chart about your pre and your post-injection education. Did you do it verbally? Have you done it written? Did you give them the written information? Informed consent has to be done. They just can't sign it. You have to go through everything with them to make sure they understand. Photos taken with consent. If you're doing a neuromodulator, you have to write in the lot number, expiry date. What's the diluent that you used? How much did you put in? How much did you use? Method of delivery. Injected with the needle. Are you superficial? Are you deep into the muscle? How many units did you use? A lot of people just write little numbers on a face. You need to have further more complete documentation than that, and definitely the patient's response. So erythema, swelling, bruising, syncope, anything like that. So you really have to make sure that we're documenting properly so that anybody that looks at our chart, if there is a college complaint or somebody else is taking over that care of the patient, they know exactly what you did. Informed consent. So this is in the document from ANBLPN. Obtaining the informed consent that the patient agrees to have the procedure, so a neuromodulator procedure by your name and the authorized prescriber, saying that they've done the consultation and they've given the clearance to have the treatment done. It says on here to include the fees. And in my practice, when I was practicing, I always had them consent for the cost of the procedure so that there was no discrepancy between yourself and, say, out front, or what they think they heard $50 and it's actually $500. So I would have them consent that. Full disclosure of the risks and benefits. So with the risks, anything that is documented in the literature has to be disclosed, which can be scary. So if you're doing a dermal filler treatment, then there's a risk of, erythema, redness, infection, but there's a risk of stroke if you're injecting in certain areas like the temples. Risk of stroke. There is risk of retinal occlusion, so blindness. There's risk of vascular occlusion that can cause tissue necrosis. All of those need to be discussed with the patient so that they will consent to take on that risk if it does happen. Must be voluntary and clear, and it can be withdrawn at any time. So I have had patients where we're just ready to do the procedure and something in their gut says, I don't think I can do this. No problem. We can do it at another time, but they can withdraw that consent anytime. So I just put in a few other considerations. So I think that any product or procedure that you're doing in aesthetics, that you read the information for use, which is your package insert from any of those, know exactly what is in there, what is the indications, contraindications of anything that you're using. Have to know the difference between on-label and off-label and what's contraindicated. If it's contraindicated, a nurse could have her license suspended for doing a contraindicated treatment or treating in a contraindicated area. So you have to know the difference between those. Understand different disease process. So when you're reading through the IFU and looking at, you know, different disease process that may affect the treatment that you're doing, understand what those disease processes, look them up, understand what they are, and it could, you know, raise a red flag that, yeah, you might not want to be treating that patient, or you may want to send them to a specialist or get clearance from their specialist, say if they're on anticoagulants or anything. Discuss all risks that have been documented in the literature, and that list continues to increase as we're doing more treatments. Consent for photo documentation. So intended use, are you using it for a presentation, or are you using it for social media, or is it just going to be kept in a secure site on your, you know, if you're using digital media? And alternative treatments. So it may be, you know, that if they don't want to do a neuromodulator, then, you know, skincare. There's other things that they can do, not just that one treatment. So that's just kind of a brief overview of what I have about aesthetic medicine. And it is an amazing career choice for nurses because, like I said, it blends that art and science. And you can really, you know, and if you're sort of independent along with your authorized prescriber, that collaboration between the two, and then with your networking, I have no regrets going into aesthetics for as long as I did. So I wish you all a successful career in aesthetic nursing. So thank you.